Welcome back to News Talk. Big progress is being made in the fight against HIV infection. Infection rates are down and treatment options have never been more effective or more affordable. But the news isn't all good. In some communities, HIV infection rates remain alarmingly high. Devin Barrington-Ward is with AVAC. Sean Jane is with Whitman Walker Health. It's good to see both of you. Thanks very much for coming in. You got the memo. It's Red Tie Day here on the program. We appreciate very much your time. Good to see both of you.
Likewise.
Devin, let me begin with you. When folks look at this issue and they try to compile meaningful numbers that they can then develop policy around, they look at infection rates, they look at people who know their status, they look at people who are on medication and whose virus is controlled. Talk about what suppressed. Thank you. What do the numbers tell us?
So the numbers tell us that overall viral suppression, for example, let's start with that. Viral suppression throughout the country, we only achieve a viral suppression rate of about 38%. And that's nationally. And then when we look at African American communities, that rate is even lower. For example, here in the District of Columbia, we have an infection rate of about between 2.5 and 3%, which the World Health Organization would deem that a public health crisis, an epidemic within black communities. If you look at areas across the district like Ward 7, Ward 8, and even Prince George's County, there are areas where the infection rates are even higher than that. And so what we see is that while HIV is a virus and is a disease that still affects many Americans, over 1.1 million Americans are living with HIV, it is having a very disproportionate effect on African American communities, specifically black gay men or black and bisexual men, and black trans communities and people of color.
Sean, we know that there have been outreach efforts, and undoubtedly there's been some success within those efforts, but the numbers that Devin references underscore the work that needs to be done still, the unfinished business, or the extent to which this is a work in progress.
Absolutely. I mean, I think that the point that Devin's making is a great one. And here in the district, as you know, we've made tremendous progress in new diagnoses. We're now at less than 500 a year. But the problem is the communities that are most marginalized, communities of color, gay and bisexual men of color, transgender people transgender people in general, and transgender people of color. Those are the communities that we need to reach the most.
And Devin, this is an interesting graphic because it shows, correct me if I'm wrong, HIV infection rates by ward, and the darker the color, the more
prevalent the virus is within those communities.
At the upper right, that's Ward 5, and at the lower right, that's
Ward 8.
Ward 8.
Yes. And so you see that's where the bulk of African Americans in the district really live. And so the virus really follows where African American communities are. And it's not because African Americans, specifically black gay men, engage in any more risky sexual activity than their white counterparts. As a matter of fact, a study from the CDC showed that self-reported condom use is actually higher amongst black MSM than their white or Latino counterparts. But it's because the viral load within the community is so high, and that viral suppression within African American communities continues to be a challenge. And then if you also paired that map and mirrored it with economic issues, so poverty, housing, joblessness, educational disparities, they would also mirror the trends of where the HIV epidemic is in the district.
I'd like both of you to talk about the challenge and the opportunity to get people to come forward for testing, and then as needed to get themselves into treatment. We've seen high-profile people like Mayor Gray and Congresswoman Norton and many others get tested in public to provide, I guess, a visual for the media and to maybe take on any stigma that might exist. So it's not as though we're not doing anything, but talk about the importance of testing and treatment.
Absolutely, it's
and what
critical.
some of the barriers might be.
Yeah, we know that a survey was done recently that over half of gay men have never been offered an HIV test by their doctor, and that's something that basically all adults should be getting, especially gay and bisexual men, because they're in an increased risk. So we know that stigma among doctors, among providers, there's stigma in the community. People are judging other people for their behaviors. They're judging themselves for their own behaviors. and they're not aware of the prevention methods that are out there. It's not just condoms anymore. There's a daily pill you can take to prevent HIV infection. People don't know about that. People don't know that they can access that. They maybe don't see a doctor regularly. Those are all huge barriers. And at Whitman Walker, you know, last year, 87% of the people who tested positive were people of color. 73% of those people who tested positive were men under the age of 35, the vast majority of whom were men of color. So the national data that Devin talked about, we're seeing it here in D.C., and again, it's the most marginalized people in society. That's really where the HIV epidemic is not only still living, but it's really where it's increasing, and that's where we're going to have to focus our fight.
Just to kind of add on that, you know, there's still a lot of stigma that exists, of course, amongst providers, but within the community itself. You know, DC actually has a opt-out testing policy where doctors in primary care and emergency room settings are supposed to be offering their patients an HIV test during a part of standard blood work. But do we really have the statistics to know if that's really happening? In addition to that, there were studies out there, PrEP. I actually take PrEP daily to prevent HIV. Well, Truvada, PrEP is the method, Truvada is the drug. But there is a lot of a lack of education amongst the community at large, and specifically within African American communities where the most benefit could be. In addition to that, we also know that if you are virally suppressed, and so you're on an antiretroviral treatment regimen, that if you actually achieve viral suppression, your likelihood of transmitting the virus to someone else reduces by upwards of 96%.
Wow.
That's the same, almost on par with the same level of protection that you would get with a condom. But again, it's about the education out there and really making sure that people have access to that information.
Along those lines, let's talk about Saturday, about National Black HIV Day. What can either or both of you tell us about that?
Well, we have testing going on at Anacostia Metro Station tomorrow, Friday, from 1 to 4 p.m. We're also doing an event at the Bachelor's Mill Club in Southeast Washington Saturday night from 10 p.m. to 1 a.m. People should check out our website, whitman-walker.org. We have testing Monday through Friday at our health centers in Anacostia and in Northwest Washington. You can get tested any day. So we really hope people take these awareness days as an opportunity to talk to their friends, their family members, their partners about the importance of getting tested. And
let's get it out into the open.
Absolutely, absolutely, and to find out about other prevention options that may be available to them.
I want to talk about Whitman Walker's merger or takeover of Metro Teenage, but I want Devin, you to have a chance to talk about Saturday and the events leading up to the weekend.
Yes, so the DC Department of Health is a great resource in terms of finding out all of the testing opportunities. Whitman Walker will be doing some testing. Us Helping Us and the Denim Project will also be doing testing as well throughout the district, and so it's really, there's no excuse to not get tested, especially this weekend. But in addition to that, I think this Awareness Day also is a call to action for advocacy to engage policymakers on this subject. There was a really interesting meeting that took place at the White House yesterday with the Office of National AIDS Policy, and they announced, along with Health and Human Services Administration, that over the next 4 years there'll be a $16 million funded each year demonstration project that will really focus in and hone in on prevention efforts and treatment efforts amongst Black MSM. So that will also look like making sure that folks are on treatment and prevention opportunities, but wraparound services like job training, job readiness, housing, and all of those myriad of needs that affect HIV prevention.
Can part of the approach on this be sort of safeguarding one another, about sort of a community, you know, let's look out for one another in terms of safer sex practices, knowing your status, getting into treatment, this sort of thing. I mean, is that too high level, or can something like that be effective as a messaging as messaging goes?
I think it has to be. I mean, and we know we do partner. People can come in and get tested with their partner at Whitman Walker, for example. And partner is broad. It doesn't mean you don't have to be married. It can be someone who you are just having a fling with, for example.
Sure.
So it's important that people have open and honest conversations about sex, and that's not a topic that a lot of people have open and honest conversations about. And that's what's really going to be something that's needed to move us forward. One thing I'll add about testing: it's free, it's confidential, it takes 15 to 20 minutes. So, you know, it's not like it costs you any money,
Right.
and it's done very rapidly.
Got about a minute left.
Yeah.
Metro Teenage has been around a long time.
Yeah.
They do great work.
Absolutely.
And they're part of Whitman Walker Health now.
We're so thrilled. You know, we wanted to expand our services to youth. We already serve about 1,800 youth a year, but this will really allow us to leverage the incredible talent and expertise of Metro Teenage to better serve youth and to provide expanded services. Metro Teenage does a ton of prevention work in the schools, at their health center. They have a mobile testing van. Now we'll be able to add substance abuse programs, mental health programs, primary care. So this is really, you know, youth is an area where we're seeing an increased rate of infections among young gay men in particular. So we really know that we need to do a better job targeting youth. And this partnership, we're so excited about it.
And if messaging for young people does not involve young people, it's likely to miss the mark.
Exactly. Absolutely.
Prevention efforts have to be led by the communities that are most impacted by it, because they know what the culture is within their community. And so I think it's a great job for Whitman Walker to partner with Metro Teenage. It's going to be very successful.
Good luck. I hope we're able to help you reach as many people as possible.
Thank you so much.
It's a very important topic, needless to say. Devin Barrington-Ward is with ABAC. Sean Jane is with Whitman Walker Health. Thank you both for being here. Appreciate your time, as always. We'll step aside, back, though, with more right after this.